According to the Ministry of Health results for 27th June, COVID-19 cumulative recoveries stand at 52,382 out of the 79,434 cumulative cases. 989 people have succumbed to the disease. Joanna Bakimi, who lives in Kasana in Chuoko Town Council, Nakaseke District, developed a sore throat and loss of smell before she tested positive for COVID-19 on 4th June.
That whole week I'd been traveling. I was in Kumi, I was in Jinja, I was in Kampala, then the Saturday before the day I got a sore throat, which is, for me, that's where I thought I got it from. I went to Mbarara for an event, and there were so many people from that event that said they later on got COVID.
Her first emotion was fear, but she gathered herself and made her results public on social media to inform especially those she had come into contact with recently.
And just breaking the stigma, because I knew a lot of people who had it, but they didn't even want to know. I knew people who had symptoms and didn't want to go to test. So for me, I saw that as an opportunity to speak out and kind of like help break the stigma that is surrounding this disease. Like, we can beat this.
Her parents were among those who had been exposed, and they also tested positive to the disease.
Monday, we started having same symptoms as she had. We remained positive, and we didn't feel this was for death.
They started on medication at home but used the herbal concoctions, which they say helped them recover quickly.
So we started straight away steaming. We had ginger and those concoction drinks with honey, and we maintained those drinks regularly. I think we steamed 3 times a day.
We have a clinic on site and a clinic officer, so he would check on me every like 2 days or something like that.
And although they swear to this treatment, which the Ministry of Health has not pronounced itself on, Bakimi appeals that
this is not a sickness that has a definite treatment, right?
Yes.
So any remedy, to me, I say thumbs up. Yeah, COVID-19 is one. Many people are going to get healed, not because they got good medicine from the hospital or what. We should avoid going even to the hospital by getting earlier treatment through these remedies and these concoctions than wait until we are worse off because we are hiding ourselves.
They also want those who have experienced and recovered from the disease to tell their stories.
People are just saying, so-and-so has died, so-and-so has died. And so it's becoming crazy.
Medical practitioners say the fear for stigma can result in people hiding symptoms or illnesses, or even keep them from seeking health care.
They always get that fear, and others, they even fail to go to medical centers. They remain at home because of fear. Secondly, feeling abandoned.
However, they give remedies on how to deal with it.
We should mind about the language we are using. One, we should encourage them. We should bring hope. We should always be there for them.
WHO, the Ministry of Health and Development Partners, have a message that says do not discriminate, and alongside it encourage COVID-19 survivors to share their testimonies. Herbert Kamoga, NTV.